Did you know that irritable bowel syndrome or IBS can actually be misdiagnosed as lactose intolerance? Irritable bowel syndrome (IBS) and lactose intolerance are two gastrointestinal conditions that often present with overlapping symptoms, making it difficult to distinguish between the two. Misdiagnosis is common, with many individuals initially being told they have lactose intolerance when, in fact, they may be suffering from IBS. This misdiagnosis can lead to ineffective treatment, prolonged discomfort, and a misunderstanding of the underlying condition. This video provides a detailed examination of IBS, lactose intolerance, their symptoms, why misdiagnosis occurs, and the importance of accurate diagnosis and treatment. Stick around until the end, and don't forget to subscribe for more insights about health and nutrition. Imagine experiencing persistent bloating, cramping, and a chaotic mix of diarrhea and constipation. For many, these symptoms might initially suggest lactose intolerance, especially if they seem to follow dairy consumption. Lactose intolerance occurs when the body lacks sufficient lactase, the enzyme needed to digest lactose, the sugar in milk. This results in symptoms such as bloating, gas, and abdominal pain after consuming dairy. However, these symptoms are not exclusive to lactose intolerance. They also feature prominently in IBS, a chronic gastrointestinal disorder with a complex etiology. IBS is characterized by a range of symptoms including abdominal pain, bloating, gas, diarrhea, and constipation. Unlike lactose intolerance, which is specifically triggered by dairy, IBS can be influenced by various factors such as diet, stress, and hormonal changes. The overlap in symptoms often leads to misdiagnosis. A healthcare provider might first suspect lactose intolerance if the symptoms seem to correlate with dairy consumption. Diagnosing lactose intolerance can be relatively straightforward, often involving tests like hydrogen breath tests or an elimination diet where dairy is removed and then reintroduced. For some individuals, avoiding dairy may alleviate symptoms, leading to a temporary sense of relief. However, if symptoms persist despite eliminating dairy, or if they don't align perfectly with dairy consumption, it may indicate a more complex condition like IBS. IBS requires a more nuanced approach to diagnosis, taking into account dietary patterns, stress levels, and other factors that may influence gastrointestinal health. To accurately differentiate between IBS and lactose intolerance, a deeper investigation into symptom patterns is necessary. IBS often presents with a combination of diarrhea and constipation, abdominal pain that typically improves with bowel movements, and a sensation of incomplete bowel evacuation. Symptoms can vary in intensity and may be influenced by stress, dietary choices, and hormonal changes. Conversely, lactose intolerance symptoms are directly tied to lactose ingestion. Symptoms generally appear within a few hours after consuming dairy products and are alleviated by avoiding dairy. Unlike IBS, which can have a broader range of triggers and symptoms, lactose intolerance usually follows a more predictable pattern linked to dairy consumption. It's also important to note that it's possible to have both IBS and lactose intolerance simultaneously. In such cases, the symptoms of lactose intolerance can exacerbate the symptoms of IBS, leading to a more complex presentation. For individuals with both conditions, identifying and managing triggers becomes even more crucial. Avoiding dairy may help with lactose intolerance symptoms, but additional strategies may be needed to manage IBS effectively. When IBS is misdiagnosed as lactose intolerance, patients may undergo unnecessary dietary restrictions and treatments that do not address the underlying cause of their symptoms. While removing dairy can help manage lactose intolerance, it may not alleviate the broader spectrum of symptoms associated with IBS. This misdiagnosis can lead to ongoing discomfort and frustration as patients seek answers and relief. An accurate diagnosis of IBS involves a comprehensive evaluation, including a review of symptoms, dietary habits, and stress factors, ruling out other conditions and using diagnostic criteria based on symptom patterns is essential for effective treatment. If you suspect you might have IBS rather than lactose intolerance, seeking a thorough evaluation from a healthcare professional is crucial. A detailed assessment may include symptom tracking, dietary evaluations, and potential trials of various treatments. Accurate diagnosis allows for a tailored treatment approach that addresses the multifaceted nature of IBS. In conclusion, navigating digestive health issues can be challenging, especially when symptoms overlap between different conditions. The misdiagnosis of IBS as lactose intolerance underscores the importance of a detailed and nuanced diagnostic process. Understanding that it is possible to have both conditions simultaneously and seeking comprehensive medical evaluation can lead to more effective management and relief. Whether dealing with IBS, lactose intolerance, or both, achieving accurate diagnosis and appropriate treatment is key to improving quality of life and digestive health. Thank you so much for watching. If you found this video helpful, don't forget to subscribe so you can stay updated with all our future content.